Alrighty, guys. So we are going to be in section 4 of your pharmacology for medical assisting book, or principles of pharmacology, excuse me. So we're going to talk about the effects of medications on body systems. This is a really short little lecture. There will be an assignment at the end of it for you guys to do a couple of assignments. So if you need to, you can always go back to your pharmacology book and kind of look at this chapter. So it's in section 4 and it is chapter or unit 21. So these are medications used for the musculoskeletal system disorders. Okay. So introduction. So the musculoskeletal system, this is composed of bones, muscles, ligaments, and tendons. Again, we have 206 bones in our bodies. We're definitely born with more bones, which sounds kind of funny, right? But a lot of our bones fuse together as we grow, right? And so we're born with way more bones than we have when we're adults. We have more than 650 muscles in our body. Anti-inflammatory drugs. So inflammation, this is a normal response to injury, infection, or irritation of the living tissue. So think about if you scratch your arm, right? What happens? Like you might turn a little bit red. It might get a little bit warm. That's inflammation, right? If you have an ear infection, I know this has nothing to do with musculoskeletal, but just trying to explain to you guys kind of what these do, right? Inflammation. So if you have an ear infection, it feels kind of hot, right? It's achy, maybe a little bit swollen, feels a little swollen inside. That's inflammation due to like a bacteria, right? Or if you fall and break your arm, your body's response is to cushion that break, right? It's to protect it so it doesn't get any worse. So it'll make it red and kind of warm. It'll swell. It'll send all this fluid to it so it'll get swollen, right? To kind of protect wherever that break or that sprain or that strain is. So that's inflammation, okay? It's that normal response of our body. It's kind of our body protecting itself. Okay. So symptoms of that are redness, pain, and swelling. Causes of this can be a break in the skin, contact with the caustic substance. So if you get something on your skin that doesn't agree, right, your skin might kind of get a little bit inflamed. Rheumatic diseases or injuries. And most provide symptomatic relief, but they don't treat the cause. So anti-inflammatory drugs, that's against, right? Anti meaning against the inflammation. So think of things like ibuprofen, that's an anti-inflammatory, right? Aleve, that's an anti-inflammatory. It's going to help to bring that inflammation down, right? Corticosteroids or glucocorticoids. These are used for multiple inflammatory conditions in several body systems. They modify, the body's immune responses. So it may be given orally. It could be applied topically with like a gel or an antibacterial cream, that kind of thing, right? Or by an intramuscular or IM injection, or by an intraarticular injection. So like an IV, okay? But it's into the artery. Okay, so anyway, a steroid is something that's going to help to bring down that inflammation because it kind of helps the immune system either up or down, kind of what it needs to do. Contraindications. So contraindications is if you have this, don't use this, right? So contraindications for corticosteroids are if you know you have a hypersensitivity. Are you allergic to it? Does it make you break out in a rash, right? You don't want to take that. A systemic fungal infection, idiopathic thrombocytopenia purpura. I'll let you guys look that one up. Acute glomerulonephritis, which has to do with your kidneys, right? This non-asthmatic bronchial disease, or any children under the age of 2. Non-steroidal anti-inflammatory drugs. These are synthetic products. So they work by inhibiting that synthesis of the prostaglandins, right? So it's usually your ibuprofens or Aleve, that type of thing, Advil, Motrin, okay? They're commonly swallowed and sometimes can cause GI or gastrointestinal distress. So if you take 600 milligrams of ibuprofen 3 times a day, every day for the next 3 years, more than likely you're going to cause yourself some GI distress. So it's going to make your stomach hurt. You could get an ulcer, that type of thing. Okay. It may potentiate anticoagulant effect of warfarin. Okay. So it may cause your blood to thin more, and it may affect blood glucose levels. It could make them go up or down. So then we have DMARDs, which are disease-modifying anti-rheumatic drugs. Okay, these are also called SARDs or second-line drugs. They're recommended in the treatment of rheumatoid arthritis to limit joint damage or joint damage that can't be fixed, irreversible joint damage, and it may decrease disease progression. This includes gold preparations, anti-malarials, penicillamine, sulfasalazine, leflunomide, and immunosuppressants. Again, your instructor, especially when it comes to pharmacology, tries her hardest and does not do well with these big words. But just think so. Let's see. So anti-malarials. That's, I mean, if somebody has malaria, right, they're going to be on an anti-malarial, that type of thing, or immunosuppressant drugs. So what do we think of when we think of that? I think of cancer, right? So immunosuppressant. So we're trying to suppress our immune system, right? So that like chemotherapy can take place, that type of thing. And then we have COX-2 inhibitors. So these are cyclooxygenase. It's an enzyme involved in aspects of normal cellular function and inflammatory response. So there's two forms of COX-1 and COX-2. So inhibition of the COX-2 reduces the production of compounds that cause inflammation, right? So this is reducing that production of the compounds in your body, okay? So examples of this are like Celebrex, okay? And then we have anti-tumor necrosis factor drugs or biological response modifiers. So these slow, if not halt, the destruction of joints. It disrupts, the activity of tumor necrosis factor. So tumor meaning a tumor, necrosis meaning the death of, right? So it preempts the autoimmune responses. So examples of this are things like Humira, Enbrel, this Remicade. So it increased, you can be at an increased risk of systemic fungal infections. Agents used to treat osteoporosis. So the loss of bone density and strength. If somebody scores or has a T score. So what they do is they kind of test the density, or they do a bone density test. If somebody has a score of negative 2.5 or below, then they're considered to have osteoporosis, right? So this leads to an increased risk of fracture. So again, kind of like we talked about before, if somebody's walking down the street and accidentally, steps off the curb wrong, that may not break an 18-year-old's ankle. But if somebody's, diagnosed with osteoporosis and has that increased risk of fracture, it could fracture their ankle or their leg or whatever. It's most common in women after menopause. Anybody want to take a big old guess why? Right? So we as women, right, our bodies are made to have babies, right? So whenever we are pregnant, if you choose to be pregnant or not, that's totally a choice, whatever, right? But if you have a baby or planning to have a baby in the future, something to understand is that baby, your body will, if you're not taking the right supplements or getting enough, like calcium, we'll say, from the foods that you eat, that type of thing, your body will take it from your bones to give it to your baby, right? So then that kind of sets you up for this path of osteoporosis. So as you start to age and get into and out of menopause, those types of effects are starting to be seen. Okay. So it can be treated with an resorptive medication to slow bone loss. So these are things like bisphosphonates, estrogen, those types of things, because it's going to help, right, to strengthen our bones. And as we lose estrogen when we go into menopause, it pulls all of that from our bones. So we're a little bit more prone to get osteoporosis. Isn't it great being a girl? Yeah, we love it. Agents used to treat gout. So gout is hereditary. We talked about that when we talked about joints. It's a metabolic form of arthritis. So it's caused by excessive uric acid in the blood, or hyperuricemia, and it deposits of urates of sodium in the joints. I'm not gonna be able to see this. I can't look at it. Calcicine is a drug of choice for acute attacks, and that's a great anti-inflammatory, right? So once the acute attack is controlled, the goal is prevention, which a lot of people are on allopurinol if they have gout attacks. Colchicine. Yep, that's how you say it. Good. All right, so skeletal muscle relaxants. These are used for muscle spasm resulting from strains, sprains, trauma, or disease. They're centrally acting muscle relaxants, and they depress the central nervous system, or the CNS, and they do cause drowsiness, dizziness, and maybe blurred vision. Flexeril is a pretty common one, right? So if you've strained a muscle, maybe you were in a car accident and had whiplash, that type of thing, sometimes they'll give you those muscle relaxants to kind of slow your muscles down to give them a chance to heal. But they are pretty high up on the list of becoming dependent on them. And that's it for that one. Super short, right? Okay, cool. So there is two assignments, I believe, connected to this one. So you guys will need to do that. And all of this is due by Sunday at 11:59 p.m. Hope you guys are good. Talk to you soon.